Good morning to our lecturer, Madam Jana, and also my dear friends. Today, my group members and I going to present our case study, which is genetic testing. Before that, I would like to introduce my group members. My group consists of me, Pavithra, Maniam, Ili Nadia, and also Ili Atira. Here is the article that we have chosen. The title of the article is Pre-implantation Genetic Testing for Monogenic Kidney Disease, which is published on 2020. So basically, a genetic test is an analysis of analysis of our DNA. This analysis can help determine if there is a mutation that can cause a disease. Genetic testing can be performed on DNA taken from blood cells or sometimes from other body fluids or tissues. Now my friend Ili Atira will explain about pre-implantation genetic testing.
Hello, I'm Ili Atira. I will talk about what is pre-implementation genetic testing. Okay, so pre-implementation genetic testing is a laboratory procedure that can be carried out as an add-on to an IVF cycle. In addition to observing what the embryos look like and how they are developing, a genetic assessment of the embryos is performed that tells us which, if any, are carrying certain genetic errors, so it can avoid transferring any of the embryos to the uterus.
The development of biotechnology and biomedical have contributed genetic testing with a lot of positive impacts. The first is earlier detection. In the context of individual, parents can get to know about children's potential risk to a disease. This is because as the pre-implantation reveals the genetic and chromosome abnormalities based on their embryos, the parents can know the risk and the severity of disease at earlier stage. This can help them to plan and change their children's lifestyle. As a result, it may reduce the risk of specific disease like monogenic kidney disease.
Next, the positive impact towards society is number of genetic disease will decrease. The number of genetic disease like monogenic kidney disease can be reduced among a community. This is because if the affected embryo does not transfer to uterus, the number of carrier babies of a certain gene mutation decrease and there is only healthy baby will be born. Therefore, in the future, they can live a normal lifestyle like other people do. They also don't have to stress about getting a baby because the future generation also will be healthy and do not contain any genetic disease.
For the next point is positive impact of law. Okay, the approach to pre-implantation genetic testing, policy making and regulation vary internationally. Many countries have a formal legislation regulating the provision of PGT. Some countries have a quiet liberal regulation, whereas other countries have more restrictive law with design agencies determining which centers can apply PGT and for which indication. For instance, in the UK, United Kingdom, the practice of PGT, pre-implementation genetic testing, is regulated by the Human Fertilization and Embryology Authority. While in France, the Agence de la Biomedicine has a similar overseeing role, permitting pre-implantation genetic testing in case of incurable heritable disease by disallowing comprehensive chromosome copy number testing.
The last positive impact toward country is can increase country income. So the cost of PGT also vary markedly between countries. For instance, in the USA, IVF and PGT treatments are usually covered by private insurance, while in the France, a fully free of charge PGT service funded by the government is available. It is clear that the difference in legislation, policies and funding have an impact on patient access to PGT. Unequal access may induce cross-border reproductive genetic care, where patients travel abroad to receive care that is not permitted or too difficult to access in their home country. Thus, it can increase the income of country that provide easy access to patient. Okay, next we move to the negative impact towards an individual, which is can have side effect and high cost of IVF treatments. The medical benefit of PGT and monogenic for adult onset conditions are speculative, and it's also impossible to predict whether effective treatment modalities will be available before the manifestation of identified condition by the time the offspring reach adulthood. Individual with the genetic traits may live healthy life for several decades before a disease may become an active concern in adulthood. Moreover, some of these genes may have variable expressivity, manifesting as much milder form of illness than anticipated, or perhaps not even expressing as illness at all, as in the case of some mutation that increase the lifetime risk of cancer. IVF with PGT monogenic also is an expensive procedure with no certainty of live birth. In addition, embryo transfer for IVF with or without PGT monogenic is associated with an increased risk of multiple pregnancy. However, other adverse obstetrical outcomes with the expectation of placenta previa appear to be related to the underlying disease and not the process of PGT monogeny itself.
The negative impact towards society is genetic discrimination in workplace. This may occur when people are treated differently by their employer or insurance company because they have a gene mutation that causes or increases the risk of an inherited disorders. To make this statement stronger, a recent survey of genetic counselors have stated that primary care and patient identified 550 people who had been denied employment or insurance based on their genetic predisposition to an illness. In addition, because an individual's genetic information has implication for his or her family members and future generation, misuse of genetic information could have intergenerational effect that are far broader than any individual incident of misuse.
Okay, for the next point is negative impact towards law. A minority of countries have no government regulation. For example, in USA, United States America has no established restriction on pre-implantation genetic testing, and it also used for non-medical reasons such as for social sexing.
Last but not least is the rate of abortion will increase. This is because if genetic testing, especially pre-implantation genetic testing, shows that embryos is affected, the prospective parents have the option to terminate their pregnancy to prevent the birth of child affected with a genetic disease like monogenic kidney disease. Thus, if many parents wish to terminate their pregnancy, even though the embryos has a very less potential, the abortion rate will arise. Consequently, this will lead to decrease in population in a country. Therefore, in future, it will reduce the labor force and hamper productivity growth if the abortion rate drastically increasing. Besides, it can cause ethical issues among the people.
Okay, next, how to tackle the negative impact of genetic technologies. Okay, there are several ways to tackle the negative impact of genetic technologies. The first is increasing the success rate of IVF. This can be done by developing the method or technique or genetic testing, especially pre-implantation genetic testing. Besides, they can also develop the genetic testing facilities, which is very suitable and necessary. As a result, the pupil can spend only less money on genetic testing.
Since the rate of abortion is increasing due to the pre-implantation genetic testing, the embryo should be aborted only according to the severity of a disease. If only those most affected embryos by specific genetic disease aborted, the abortion case will decrease. Another thing is the healthcare agencies may improve or strengthen the law of abortion so that it may reduce the rate of abortion. Next, in order to avoid genetic discrimination in workplace, we can restrict the use of genetic information in workplace. This is because there is no scientific evidence to substantiate a relationship between unexpected genetic factors and individual's ability to perform his or her job. Thus, most expert groups recommend prohibiting or severely restricting the use of genetic testing and access for genetic information in workplace.
So the next strategy is straighten the law. For the impact negative in law, we must straighten the law because same like the social sexing, same like abortion law. The law of social sexing also should be improved. Also, people should know that every life is matter. When the law is strengthened, the rate of social sexing can be reduced.
Okay, for conclusion, pre-implantation genetic testing has been developed in an effort to offer choices to women at risk of having children with genetic aberration, to provide reassurance to women at risk, and to enable women at risk to continue pregnancy. However, this pre-implantation genetic testing raises several ethical, moral, and legal dilemmas in relation to its application. There seems to be global agreement that there is a real need for pre-implantation genetic testing as benefit for its use considerably outweigh any proposed risk or doubt.
Here are the few references that may help further understanding of genetic testing and pre-implantation genetic testing. That's all from us. Thank you very much.